My name's Will Segal. I've worked at Accolade for about 7.5 years. I chose to work for Accolade because my previous career, I was getting burned out. I really wasn't helping people. I was in behavioral health care. As a steward, I found that every single day I was helping people in tangible ways versus that 3 to 4 times in over a decade. This was a member that we actually reached out to as part of a care outreach. We found out that he was doing pretty well. We did help him find a primary care physician, which he did not have. But more importantly, we educated him about what Accolade can do for him in the future, should he need us. When we followed up with this member, we found that he was still doing well mentally and physically. He had been seeing a virtual therapist, and they were scaling back to bi-weekly visits. A month after that, he was actually not doing better. He was doing worse. And he reached out to us again, which, having come from a behavioral healthcare background, that is both the most important step, seeking help, and also the hardest. But he already knew what we could do for him and that we were here to help him. So he was able to take that step and get the support he needed. The clinician that spoke to him strongly suggested that he reach out to his therapist that day to up his services. We followed up with this member a couple days later, and he had talked to his therapist, and their recommendation was that he see a psychiatrist to talk about possible medications. What we did for him was help him find some in-network psychiatrist options. We also suggested that he talk to his primary care physician, as they can also prescribe meds, and he might not be able to get in with a new psychiatrist for a little bit of time. We next connected with this member about a week later, and he actually disclosed to us that he was in the emergency room due to a drug overdose. He also let us know that he was not honest at the ER about all his symptoms, but he was honest with us about what was going on. So we took the next steps and we secured an appointment for him with his primary care physician. We put in motion getting him to a psychiatrist as soon as possible, finding somebody with the soonest available appointment. We got him connected with his therapist again that day. I just think that really goes to show what the value of Accolade is. It's not just checking network status, reviewing claims. This member had built trust with us that he did not display with the physicians that he was in the care of in that emergency room. He felt comfortable talking to us about what was really going on so that we could best assist him. And I think that level of trust comes from how we approach our service to members. We treat them as people, we talk to them as people, we make sure they know everything that we can do for them. We also make sure they know that we do these things because we care about them. Seeking help when you have symptoms of depression or anxiety or any other behavioral health care concern is the most important thing you can do. We're here to help learn about what resources you have, navigate your benefits and your health care, and get better.